Antibiotics are medications used to treat bacterial infections by either killing the bacteria, bactericidal, or inhibiting their growth, bacteriostatic. They play a crucial role in modern medicine in combating a wide range of bacterial infections. Here's an overview of the purpose of antibiotics and how they fight infections. Targeting bacteria. Antibiotics are specifically designed to target and act on bacteria. They are ineffective against viral infections, such as the common cold or flu, as viruses have different structures and mechanisms of replication. Mechanisms of action. Antibiotics exert their effects through various mechanisms, depending on the type of antibiotic and the specific target within the bacterial cell. Some common mechanisms include inhibition of cell wall synthesis. Many antibiotics, such as penicillins and cephalosporins, interfere with the synthesis of the bacterial cell wall. This weakens the cell wall, leading to cell lysis and death. Inhibition of protein synthesis. Antibiotics like tetracyclines and macrolides interfere with bacterial protein synthesis, preventing the bacteria from producing essential proteins needed for their survival and reproduction. Interference with nucleic acid synthesis. Certain antibiotics, such as quinolones, inhibit the synthesis of bacterial DNA or RNA, disrupting the bacteria's ability to replicate and reproduce. Disruption of cell membrane function. Some antibiotics, like polymyxins, disrupt the integrity of bacterial cell membranes, leading to leakage of cellular contents and bacterial death. Specificity and selectivity. Antibiotics are often designed to be selective for bacterial cells, minimizing harm to human cells. However, some antibiotics may have side effects or impact beneficial bacteria in the human body, particularly in the gastrointestinal tract. Spectrum of activity. Antibiotics can have a broad or narrow spectrum of activity. Broad-spectrum antibiotics are effective against a wide range of bacteria, both gram-positive and gram-negative, while narrow-spectrum antibiotics target specific types of bacteria. Treatment of infections. Antibiotics are prescribed by healthcare professionals to treat bacterial infections, ranging from common respiratory and skin infections to more serious conditions such as urinary tract infections, pneumonia, and sepsis. Prevention of infections. Antibiotics are also used prophylactically to prevent bacterial infections, particularly in situations where there is a high risk of infection, such as before certain surgical procedures or in individuals with weakened immune systems. Resistance and stewardship. The misuse or overuse of antibiotics can lead to the development of antibiotic resistance, where bacteria become less responsive to the effects of antibiotics. Antibiotic stewardship programs aim to promote the responsible use of antibiotics to preserve their effectiveness for future generations. It's important to note that antibiotics are not effective against viral infections, and their inappropriate use can contribute to the development of antibiotic-resistant bacteria. Therefore, antibiotics should only be used under the guidance of healthcare professionals and in accordance with prescribed dosages and durations.